Did you know that joint replacement surgery has been on the rise in recent years? Now, about 773,000 Americans will have a hip or knee replaced each year.
And to what do we attribute this? Our joint replacement experts will tell you on this week's Health Talk.
We are up next. We're back with Courtney Liddy, Joint Care Coordinator at Norwalk Hospital, and Allison Vale, Patient Care Manager at Norwalk Hospital. Welcome.
So we just heard from two wonderful patients and their doctors, but it really takes a team to care for these patients. Alan, you're in charge of nursing on the Joint Replacement Center, and Courtney, you are a navigator. Is that right, or coordinator?
Yes.
Maybe you can tell us a little bit about what is the program for patients that's going to have a joint replacement?
Sure, great. So what we do, as a coordinator, I reach out to all of the patients before they have surgery. So I get a list of names, and I'll call them to see if I can get them to attend our pre-op education seminar. We hold it the first and third Tuesday of every month, and we really outline the whole process. So we tell them what the expectations are prior to surgery, how they need to check in and see their primary care physician, and then the blood work that will have to be done. And then the whole
exercises too?
We do. We give them a comprehensive guidebook that has some exercises, because really, you know, the stronger a patient is going into surgery, I think the better they will do overall. As we saw with our last two patients, they were very strong. But then we will educate them about the process in the hospital, and then what to expect upon going home. So
there are very few surprises for patients who actually come to these sessions.
Exactly. A few years ago, you know, when we would go in to see the patients, they were afraid to move in bed. But you can always tell the patients that do come to the class, because they're up and moving, and they bring their clothes, and they're really happy to be there.
Right.
And Allison, what are the roles of nursing and in all leading this wonderful unit?
Well, we have a specialty staff, certified orthopedic trained nurses and techs, physical therapists, occupational therapists, and the whole team comes together working with these patients. Our protocols are put together so that, you know, everybody knows at 5 o'clock we're going to have this happen. We're going to have blood draws, you're going to get coffee and a muffin. And so the nurses are getting the patients up, they're helping them up the first night of surgery. So everybody is really on the same page. They know what to expect, and it makes it run really smoothly.
Now, we talked a lot about pain in the earlier segments, or the lack of pain.
Right.
And I'm assuming that there is some pain involved with a lot of these orthopedic procedures, although, again, we have minimized it significantly. Tell us what you see from the nursing perspective, and what interventions are made from nursing staff to help these patients through recovery.
They were definitely exceptional, and we do have patients with you know, low levels of pain, but we do have patients who are experiencing pain. But what we do very well, I think, is manage the pain. So we say it's pain with a purpose. So where the patient's experiencing 4 years or 5 years, however long, of this chronic pain that just never goes away, there is going to be some pain. We'll manage it, but the point is that we're going to have you working, we're going to have you moving, and yeah, you're going to feel it. It may be uncomfortable, but the idea is you're going to end up where you're going to have very little or no pain. So the way we manage it is we do, as the docs both said, talk about, you know, we have the long-acting OxyContins we use a lot. We have the short-acting for breakthrough, mostly just oral meds, not the IV.
There's a lot about pain management and movement. We have a video, again, of your work in the Joint Replacement Center, which we'd like to bring up, and maybe you can describe what we're seeing during that video. And I know that...
Yeah. So here's a gal here. She's working with Manisha, our occupational therapist, and she's learning how to put her socks on with the sock aid.
That looks like that can help a lot of us.
Yes, definitely. Especially after hip replacement, though this gal had a total knee replacement. There's some special precautions, like bending past 90 degrees, that those who have hip replacement shouldn't do. But here she is walking. This is only a day or two after surgery. So we really get patients up and moving right away. Even like they had said before, the day of surgery, we sit patients up at the edge of the bed, get them standing to see.
Are people afraid to do that? I think I'd be afraid.
Yeah, they are afraid. But you know what? I tell them in the education session that they're able to stand up. I tell them they're able to put as much weight on that operated leg. We use a walker for all of the patients until they're walking smoothly and symmetrically, and then we'll promote them to a cane. But for the length of their stay in the hospital, most of the patients are using a walker.
And
here, our stairs, most patients are really anxious about doing stairs, but I tell them it's not that much more difficult than what they're doing prior to surgery. I always encourage them to use the railing, because railings are helpful to all of us, and then I have them go up with their good leg, one step at a time, good leg being their leg that was not operated on, and then back down with their operated leg.
Allison, what are so you talked about length of stay. How long are these patients in the hospital after a hip or a knee, and what are some of the criteria for getting a patient home?
Well, we're looking at 3 days typically, sometimes even 2 days now.
Wow.
Mostly the patients are really ready to go. I mean, by the time they can do the stairs, they can walk up and down the halls. The pain is managed with the oral medications. And as long as we've got everything else stable, they're pretty much ready to go. And usually they want to go.
And we have about 20 seconds left. I know in the past, an awful lot of these patients went to nursing homes and other rehab facilities for additional rehab. The goal is really to get people home now, isn't it?
It really is the goal.
To go from 3 or 4 days in the hospital home.
People thrive at home in their own setting. They can eat their own food. They can sleep in their own beds. So that is truly our goal, though we know it's not for everyone.
And continuing their exercises.
Exactly. We get them home therapy. Therapy will start the day after surgery or day after their discharge, and they really do great.
And that's a wonderful way to end the show, is to send people home with a new joint and no pain.
Exactly.
That's right.
And we follow up with them after that.
So we do answer questions on Health Talk. If you have a question you'd like to ask Vicki and me, please contact us at healthtalk@norwalkhealth.org.
We would like to thank our guests today, Dr. Michael Lynch, Richard Nicholson, Dr. Nicholas Polifroni, Terry Bagnulo, and Courtney Liddy, and Allison Vale. Thank you. I'm Dr. Vicki Smitak.
And I'm Dr. Eric Major. We'll see you next week on Health Talk.
First 30 seconds are all I remember.